Southern Plains Medical Center presents your hometown medical minute, and your host, Hal Brock.
Hey everybody, happy Friday and welcome to our podcast, Your Hometown Medical Minute. I'm your host, Hal Brock, and with me, as always, behind the cameras, our IT Director, Mr. Ed Harrison. So, Ed, we were able to make it through another week, had some wonderful weather. It's one of those weeks where you can just roll down the windows every day and crank up some music. My choice, always Cool 105.5 FM, Mr. Lee Roberts cranking some great rock and roll music for your drive home every day. Of course, Cool 105 right here in Chickasha. Keep mindful for tomorrow, as it looks like some severe weather might creep in. So always stay weather aware here in Oklahoma, because you just never know. Real quick, before I introduce our guest for this week's show, which is absolutely going to be a wonderful show, wanted to mention next Thursday, back by popular demand and many requests to my email, my personal email, is SPMG's Dermatology free skin cancer screening. So this one, it's pre-summer. It's time to make sure that you can get outside and be safe all summer long. Next Thursday, May 23rd from 11 a.m. to 1 p.m. So today, Ed, what a cool show, because Dr. James Freed, pediatrician, is going to join us today. Of course, he's been a pediatrician here in Grady County, specifically here at Southern Plains, now going on 44 years. I swear, anytime I go to a meeting anywhere, somebody has always told me that Dr. Freed was actually their pediatrician. So we're going to take a look at ADD and ADHD. It's kind of a sensitive topic, but I do business development here for Southern Plains, and I was actually out in Clinton, Oklahoma a couple weeks ago talking to one of our referral sources who sends us patients from all the way out in Clinton, and an issue that they were having is they couldn't find somebody that was taking their time and diagnosing ADD and ADHD the proper way, and doing a whole treatment process. So Dr. Freed does a wonderful job doing that, so you're going to get to hear from him in just a moment. But first, we're going to check down with Southern Plains Vision Associates and our correspondent, Frankie Brantley, with her segment, Seeing Clearly with Frankie Brantley.
Hey guys, hope you've had a great week just like we have here at Southern Plains Vision Associates. Today I wanted to introduce to you something that we've got that's new here. It's called the Procura. It's actually a contact lens, basically, and it has amniotic membrane inside of it. And that's going to help out if you've got chronic dry eye, any pain, redness, irritation, anything like that. So you guys can just come in, the doctor will place it in your eye, and it stays for 3 to 5 days. You'll come back in after your 3 to 5 days is up, have it removed. Procura is the only FDA-approved device that's used by optometrists and ophthalmologists that's going to offer you guys quick relief and an anti-inflammation. So it actually has an amniotic membrane in it that has natural anti-inflammation and anti-scarring properties inside of it. The tissue is actually donated by mothers who have a scheduled C-section that will consent with their doctors, obviously, before they donate. So the mothers actually have to go through a physical, mental, and a social assessment before they can donate it, and then it goes to a tissue bank that is FDA regulated. So if you guys are experiencing any of those symptoms, feel free to give us a call at 1-405-592-EYES.
Hey, and I'd like to welcome our guest, Dr. James Freed. Dr. Freed, man, thank you so much for taking your time.
It's good to be here.
Well, you know, you're pretty much everybody's pediatrician here in Southwest Oklahoma. I mean, everywhere I go, I run into somebody that you were their doctor. So really, I think what everybody would love to know is, what got you into medicine?
Well, when I was in the 5th grade, my best friend and I decided we wanted to be doctors.
Okay,
and
wow.
So in the 5th grade, I decided I wanted to become a doctor. And so that was my goal all through, junior high and high school and college. And so that was my agenda, was to make sure that I became a physician. And then as I went through training, because I love kids, it became very apparent that I needed to become a pediatrician. And so it was a very easy choice for me to decide on pediatrics because I love kids so much. So.
Holy cow. I mean, well, that's the kind of dedication that it really takes. I mean, what kind of brought you down here to Chickasha? Are you from around the area?
I was actually born in Chickasha.
Oh, no kidding. Okay, I didn't know that.
I'm probably one of the only physicians that's practicing now that is from Chickasha.
No way.
But I lived all my life in Oklahoma City. I was born here because my dad was away in World War II, and my mom was staying with her folks. And so I was born here and then subsequently moved to Oklahoma City and grew up in Oklahoma City. But then came to Chickasha because whenever I was the chief resident in pediatrics at Children's Hospital in Oklahoma City, Southern Plains Medical Center was probably the best multi-specialty clinic in the state of Oklahoma. And the reason how I came to know that is because the chief resident accepted all the referrals.
Wow.
And Dr. Herndon and Dr. Orr were constantly sending, the patients up our way, and I had a lot of conversations with them. So didn't come back because I was born here, but I came back because of the nature of Southern Plains Medical Center.
Well, how cool. And thanks to great physicians like you, and definitely some newer providers that have came in the last couple of years, I think we're back on that track to be one of the best, if not the best, multi-specialty clinic in Oklahoma.
Exactly.
One of my favorite pictures is of you on the sidelines of some of the local basketball colleges and high school. What's one of your favorite memories here at Southern Plains?
Probably one of the favorites. One year we decided to have a benefit baskevball game between us and the lawyers.
Oh, wow, okay.
to raise some money. And so that was quite an event where, because of the rivalry between physicians and lawyers, that it came to be quite a deal. They even took a piece of plastic and put it over the rim so that we couldn't shoot it in, and one of our physicians back then, Dr. Whedon, shot and the ball stayed there.
No way.
And so they actually counted it. So they tried to cheat us, but we still were able to beat them, kind of thing. So
that's an amazing story. I'm sure they had a very legal reason to get her. My sister's an attorney, so you know how they convince words. That's awesome. What we want to talk to about today, and actually I ran out to one of our referral sources out in Clinton, Oklahoma, and she had mentioned that she could not find a provider that specializes that tests for ADD and ADHD. So I wanted to have you on the show because I didn't know that there really aren't that many providers that are as trained and specialize this as you do.
There are a lot of physicians out there that try to deal with attention deficit disorder, but there's a right way and a wrong way to evaluate those patients.
Right.
And a lot of times what happens is they just fill out a little check form, and within 10 minutes, a doctor has to decide from that form as to whether or not, they have attention deficit disorder. I do not feel that's an appropriate way to make that evaluation. And so what I do is a complete evaluation, which is called neurodevelopmental testing, because attention deficit disorder involves more than just hyperactivity or non-hyperactivity. It can involve people that have anxiety. That can be people that have oppositional defiant disorder, learning disabilities, depression. And I guess one of the best ways that I can explain things to you is one of the first patients that I saw was a 7th grader, and he had actually threatened to commit suicide. And he was doing that because he was a tremendous basketball player, but he, because of his attention deficit disorder and learning disabilities, he couldn't stay eligible. And so he presented having threatened suicide, but his basic problem was that of attention deficit disorder and learning disability. 1 year later, after we evaluated and treated him, he had become the president of his class, making A's and B's, and now was able to stay eligible because now he was treated, and he wasn't depressed anymore. He was just depressed because he knew that he just couldn't do this by himself. And so you can change these children's lives because many of them are hyperactive.
Right.
Some of them are not hyperactive. Many of the girls that have this are not hyperactive at all. But they're having trouble focusing, concentrating, paying attention. So the three main components of attention deficit disorder, what we call the combined type, is trouble paying attention, being impulsive, doing things quickly without thinking.
Right.
And then the last but not least is the hyperactivity, which
hyperactivity.
sometimes is there and sometimes it's not.
Okay.
But to go and just fill out a little check sheet
No.
and then within 10 minutes or so decide if somebody has attention deficit disorder is okay, but it certainly misses things that can be there contributing to the other things, that are going on.
More than 2/3 of the people that are diagnosed with ADD, like you said, also have something like anxiety, depression, Tourette's is one, and then just behavioral disorders just in general, right? I mean, so...
Just like oppositional and defiant disorder, those are kids that are, they're having trouble adjusting to authority.
Okay.
And so as a result, then they get into trouble at school or, with the police. So it's a whole complex of what they're called comorbid conditions. They are not necessarily present in every case of attention deficit disorder, but are there in about 1/3 of the cases. And so if you don't evaluate the whole child, then you're not, looking at the whole big picture.
Right. So, and you mentioned some of the symptoms when you were kind of going in there. Are there things that aren't the big attention getters that parents can look for where it's possibly ADD?
Okay. And I think probably the biggest area would be the what we call inattentive type, where they're just having trouble focusing and paying attention, but they're not hyperactive. Those tend to be girls more than boys, but boys can have it. They'll be probably in the 4th or the 5th, maybe 6th grade. Up until then, their intelligence has carried them, but finally, at about the 4th or the 5th grade, 4th, 5th, 6th grade, their performance starts to go down because their intelligence won't carry them anymore. They can't stay focused. And so those are the biggest ones that a lot of time get overlooked because they've done okay.
Right.
But then starting about the 4th, 5th, 6th grade, it just becomes so complicated. Their learning has to be based upon building blocks, and they can't overcome the focus and inattention that they have.
That makes sense. I mean, 6th grade, especially when algebra starts coming in and you start throwing letters with numbers, that threw me in 6th grade, so I can only imagine. What kind of treatment programs are there?
It's just like a child that might present with juvenile diabetes.
Okay.
That child is going to have juvenile diabetes the rest of his life. But it doesn't mean that he can't live, a very normal life. And in that juvenile diabetic, we have to, give them insulin.
Okay.
We have to have them eat properly. We have them exercise, check their blood sugar. When we do all of that, then that's when we get the best outcome in a juvenile diabetic. It's the same way with attention deficit disorder. Many people try to treat it with just medicine.
Right.
Some people try to treat it with just behavioral modification, and then you have to deal with the comorbid conditions. When we do all of that together, medication, behavioral modification, dealing with their comorbid conditions, then we can get those kids to, a completely normal situation for them. They have to do things differently, maybe,
right,
than just like the child who has diabetes has to
live a different life. Right, yeah.
But you make the adaptations that they need to be made, and then they can fit into, this normal, situation. And a lot of these kids who have attention deficit disorder, because they are so active, they can get a lot of things done.
Right, yeah.
And so therefore it's channeling that energy into a certain situation where they can, excel. And so it's a matter of medication, behavioral modification, sometimes counseling, sometimes, dealing with their learning disabilities, dealing with their depression. And so you have to deal with the whole patient and not with just one particular diagnosis.
Yeah, for sure. Gosh, just throwing medication at somebody doesn't seem right now that you explain it that way either.
You have to evaluate each patient because every patient is different.
Yeah.
And what you do for person A is different for person B, kind of thing.
For sure. How do you go about doing your testing?
Okay. So the first thing that we do is we have some history sheets that we have sent out.
Okay.
One of those is for the parent to fill out. It's a very extensive, complete history of all of the stuff that's happened to them. The second part is a information sheet that the school, or at least one teacher or more teacher, fills out. And that gives me the basic information about what's been going on.
Yeah.
And so it's a very complete evaluation by both the home and the school.
Okay.
Then after we have that, I look that over and make sure that they need to be tested, because sometimes it's apparent from the history that they have something else that needs to be dealt with in another way. But if they seem to have the criteria, then we do what we call neurodevelopmental testing, which is
Okay.
a full hour of neurological things and developmental things. And so I'm actually with the patient for 1 full hour
Wow.
where
Wow.
we do these various neurological and developmental tests. After that is done, then I have to grade that to their age level.
Okay.
And then once we grade that to their age level, then I see the parents back and follow up and give them the report. And so basically I spend about 2.5 hours, for every patient that we see to start in the progress, because you don't want to miss anything, and you want to make sure that you pick up every, comorbid condition that is there. Whereas a lot of times when the diagnosis is made by other physicians, they'll go in and they'll see the patient for maybe 10 minutes in the office, look at these little check, things, and decide that they have it or not. And so it's not, to me, the right way to go about. And that's why we have some bad publicity, because we have physicians that do try to treat it that way versus doing a complete evaluation.
Well, I would think, and for me, and it's not like it's so drastic, but my work behavior is different than my home behavior. And I'm more comfortable at home than I am at work. And I have, professional responsibilities here. Same when you're a child. You do act differently, whether it's small or big, at school, at work, definitely at a doctor's office.
Yeah. And that's where usually if I have a disparity between what the parent says and the child says, or the school says,
right,
then me having my own evaluation allows me to make sure where we're really dealing with.
So we've talked some about the behavioral disorders, but obviously the full treatment, as you're talking about, does include medication. And like you mentioned, there's maybe some questions about medication. Can you kind of describe or tell people about your medication process?
Sure. Basically, attention deficit disorder has been proven to be a condition in which they're missing a neurotransmitter.
Okay.
So it's very similar to like a diabetic. A diabetic is missing insulin. A juvenile diabetic is missing insulin. So we replace that insulin by a medication that we give.
Right. Yeah.
So it's the same way. Children with attention deficit disorder are missing a neurotransmitter.
Okay.
And as a result of that, we give a medication that does the same thing that the neurotransmitter does.
That makes sense.
There's a lot of anxiety about that because a lot of the medicines that we use are stimulants.
Right.
But the studies actually show that the children who are treated have less, drug abuse than those that are not treated.
That makes sense.
They're very safe, used in the right hands, and with the full explanation of all the side effects and the benefits of it. It's just like insulin. Insulin has side effects. You give it in the wrong way, you give too much, give too little. You have to monitor what is given, and the studies actually show that the best long-term outcomes come from those that are given medication and behavioral modification together.
Well, it makes sense because for people that have attention deficit disorder, going out and finding something to deal with those symptoms like the anxiety, like the depression, is not the same. So you do go look for those outlets, abusing drugs, right?
Exactly. And about half the adults are able to eventually do without the medication if they learn enough behavioral modification techniques.
Okay.
It depends upon their job and how severe they have it. But about half adults continue to be on medication even into adulthood. And so, and we're able to use the same medicines in adulthood that we do in children. So they're safe, and we monitor that on basically every 6-month basis to make sure that there are no negative side effects coming from the medication.
Well, it sounds like most things, if you can identify the symptoms early and you can go in and you can get the right treatment program, not just go in and check boxes. I agree with you. I don't see that being beneficial, but going and that's just going to be long-term the most beneficial.
Exactly. Because we're really changing lives. Because left untreated, they tend to drop out of school early. Mm-hmm. They tend to have more trouble with interpersonal relationships. They tend to have trouble keeping a job. And so A lot of times in the past, this has been thought to be a school problem, but it's not. It's a true life problem. And so that's why I guess I enjoy this so much, just because, like the young man I talked about earlier,
Amazing.
changed his life. And so you can change the lives of these people because it's not a school problem, it's truly a life problem.
Man, that's amazing. And you know what? It's so evident because, again, everywhere I go, I run into somebody that you've treated and they just tell me how much they love you and how much they've appreciated all that you've done for them. So on behalf of pretty much Southwest Oklahoma, but for sure Southern Plains, thank you for all that you do for everybody. It's pretty amazing.
It's enjoyable to be able to help these young people who go from being frustrated and don't want to go to school and are just spending 3 or 4 hours doing homework that everybody else can do in 30 minutes, and so
missing out on playtime and all sorts of things.
And so just because they can go on to become, because it has nothing to do with intelligence, it just has to do with focusing and concentrating.
Well, it totally makes sense, and thank you for your rigorous testing and treatment programs and actually paying attention to detail. I know it makes a difference. If you guys notice any symptoms in your children, you can definitely reach out. Of course, you can see Dr. Freed. Give us a call, 405-224-8111. For more information on Dr. Freed, you can always go to our website, www.spmcmed.com.